What's going on, everyone? It's Alex here from Alex Physio. Today we're going to be using the location of your knee pain to try to figure out what the diagnosis is. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia. And today we're going to be trying to use location of where your knee pain is to try to figure out a diagnosis. Of course, this isn't medical advice, so please don't take it as such. Location is just one of the many factors that is playing a role in determining what the diagnosis is if you are struggling with knee pain. As always, please see a medical provider if you have knee pain or you've had an injury. So we're just going to use my kneecap as kind of a landmark, and then we're just going to say where the locations are relative to that kneecap. For the first location and possible diagnosis is we're looking at just below the kneecap. That's where our patellar tendon lies. So if you find that you have pain around this tendon region, you can strum it if you just move your finger side to side. That could indicate something called patellar tendinopathy or jumper's knee. This tends to be common in a lot of individuals who go from doing too little to too much from an activity perspective, or a lot of jumping activities where that patellar tendon is overloaded. And one of the best things that you can do if you have patellar tendinopathy or tendonitis is to try to work on slowly rebuilding that load tolerance of the tendon. So doing things such as isometrics and progressive strengthening exercises to try to help improve the stiffness of the tendon and improve the pain as a result. So that's the first one, just below your kneecap, patellar tendinopathy. And then if we go just below that, we have a bony bump. This is called our tibial tuberosity. Now, if you're somebody who's complaining about pain around this region, and this tibial tuberosity can be enlarged in individuals who have this condition, it's called Osgood-Schlatter Disease. So it's more common in the adolescent population, particularly in males, as they're undergoing growth spurts. Because that patellar tendon attaches to that tibial tuberosity, there could be changes in the characteristics of it, where you can see it slightly bigger than the other knee, and that can also cause pain, because as you're growing, not only are your bones growing, but your tendons and your muscles are having to adapt to the changes in these growth spurts. And as a result, sometimes that repetitive bending and straightening of the knee, especially if you're partaking in these sports, that can irritate that region there. Fortunately, it is something that tends to get better with time, and also a little bit of physiotherapy, exercises, stretches, strengthening exercises, but something that's more common in the younger adolescent generation as they're going through a growth spurt. So that's number 2, Osgood-Schlatter Disease, just below the patellar tendon in your knee. And then if we look at the inside of our knee, so there's a couple different causes for the inside of our knee. If you make an L shape with your index finger and your thumb, you can find where the joint line is. You can kind of just find that divot between your tibia, your shin bone, and your femur, your thigh bone. And if we press on the inside of that area where that joint line is, if that's tender, if that's painful, that could indicate a medial meniscus injury. So number 3, medial meniscus injury. One of the tests is pain with feeling that joint line. Also, if you're complaining of clicking or locking, pain on the inside of the knee. And then there's other tests, such as if you do just like a quarter squat and you try to twist on that knee, that can be provocative or reproduce some of the symptoms. Plus there's other tests that physios can do, like the Apley's test, the McMurray's test. These are just different tests to look at if it is the medial meniscus. Okay, so pain on the inside of the knee, medial meniscus can be. So that's number 3, medial meniscus. Number 4, so pain around the inside of that knee could be a little bit higher than that joint space region, but it is a little bit more generalized. It can be your MCL. So the MCL is your medial collateral ligament. This is a ligament that can be irritated or injured with individuals who tear their ACL or injure their meniscus. It can be one of the other injuries that can happen in occurrence with it. one of the ways that we can test if it is the medial meniscus is a test where we try to apply pressure inwards. Like if you think about when your knee buckles, that puts more load or tension on that MCL. There's people who have some of these anatomical differences combined with a lot of knee collapsing, plus not really having built up the sufficient strength. So individuals can have MCL injuries if there's a force that's applied inwards or towards the inside of the knee where there's a lot of load on that area. Like if you land awkwardly and your knee buckles, that can be possibly an MCL injury. And MCL injuries are graded from 1 to 3 in terms of how much damage there is. So that's number 4, MCL. And again, these are all things that can be rehabbed conservatively. They don't necessarily need surgery. MCL doesn't require surgery. Medial meniscus, unless it's an unstable or a very severe meniscal tear, doesn't require surgery as well. Same thing with the Osgood-Schlatters and the jumper's knee as well. If we go above the kneecap, so here's my kneecap, the top of it. If we go above here, we're looking at a possible quads or quadricep muscle tendinopathy. And if we go a little bit higher, a quad strain or strain in the muscle belly of the quad. So we'd be looking at things such as pain with pressure around that area, pain when you try to straighten your knee, and also pain when you bend the knee, because when you bend the knee, you're putting that area on stretch, and when you straighten that knee, you're applying tension to the muscles and tendon in that region. This can come as a result of either direct trauma, like if you get Charlie horsed in your knee or in your thigh region, or just from a repetitive or a forceful bending to straightening moment or a straightening to bending moment that can irritate the symptoms. Again, benefits from a period of rest initially, and then trying to work on slowly building up the strength and the flexibility in that area. Okay, on the side of the knee, we have a couple of different structures here. If you look here, this is I have it a little bit more prominent here. This is something called Gerdy's tubercle. So this is a bony prominence that's located around your shin bone. This is where your IT band attaches. So if you have pain around the attachment here, or it can be a little bit more generalized, it could be a little bit above as well, you can have something called IT band syndrome. This is pain on the outside of the knee that can come as a result of repetitive movements, such as runners, people who run a lot. That movement or that friction that's being applied with the repetitive bending and straightening of your knee at those specific ranges of motion can sometimes cause some of that knee pain. Again, something that responds well with physiotherapy and getting on an appropriate load management running program and strength program to try to help with those symptoms. But that would be IT band syndrome, where that Gerdy's tubercle is right here, that bony bump. If we move slightly outwards or laterally, a few centimeters beside, we have something called our fibular head. So we have our shin bone, and then we have our fibula, which is located just beside or laterally to that, a long, thin bone. And sometimes people can have what's called, and there's a joint there. You don't get a lot of movement there, but it's your proximal tibial fibular joint. And some people, if they have pain around that area, you can have something called proximal tibial fibular instability. And this can come actually as a result of ankle injuries. If you've had ankle injuries like high ankle sprains or injuries that involve bringing your ankle up and out, that actually causes movement around that region as well, that tibial fibular joint. And over time, if you've injured your ankle numerous times, that can actually irritate that joint there and cause a little bit of instability. So pain on the outside of the knee can be provoked with a lot of repetitive movements of the knee as well, and rehab with strength, gradual loading, trying to figure out that it is that's actually causing the symptoms, and going from there with the recovery. Because there are other structures around there that can also cause pain. That doesn't necessarily have to be the joint, which leads us to our next one, which is if you have a hamstring strain. So hamstring strain, one of the hamstring muscles, it attaches on your fibular head. So it originates around your buttocks and attaches on your fibular head. But this can also be irritated, and one of the ways that you can tell or look for that is if you have pain when you try to resist knee bending, because you're loading that tendon more. So if you have the pain and it's on the outside of the knee, then it might be that that hamstring muscle is injured. And then obviously if you try to actively bend the knee as well, that can reproduce it as well. So two different possible pain pathologies based on having pain around the fibular head. Number 9 would be a lateral meniscus injury. So this would be if we kind of did our web space to try to find the joint line. So this is my joint line right here. If I had tenderness around that joint space area, that can indicate a lateral meniscus injury alongside with the clicking, the locking. The lateral meniscus injuries tend to be a little bit less common versus the medial meniscus injuries, but regardless, it can happen. Pain around that joint line area and pain with some of the tests that we mentioned as well. If we have pain on the front of our kneecap, we could have either a patellar contusion, like if you just land directly on your kneecap and you get some bruising, that would be pretty simple, slash patellar fracture. If it was significant enough and you actually had a lot of tenderness right on the front of the knee, it could be that the patella is fractured. So you would know that by doing an x-ray to rule that out. Number 11 would be if you had pain just inside or deep within that kneecap region. That could be something called patellofemoral pain, and that's just pain in your patellofemoral joint or pain in your knee joint area. That's where you've ruled out all the other causes that we've mentioned before, but you just have this pain on the, it feels deep, sore. It's not really specifically tender to touch, but it might be if you press around that area. It can be from arthritis. It can be from just an irritation of the kneecap in and of itself, called chondromalacia patellae, or it could just be this patellofemoral pain. This is something that's exacerbated, depends on the age. Something like arthritis would be generally people who are older than 50. This chondromalacia patellae would be in younger individuals, younger than 25. And then patellofemoral pain can be anybody along that spectrum where other conditions have been ruled out. And again, this responds well with physiotherapy as well, not something where surgery is indicated unless with arthritis, if you've tried physio, you've tried all your conservative care, then maybe a knee replacement might be looked into if you've tried everything else and you have really severe knee arthritis. And then the last one is Hoffa fat pad syndrome or fat pad syndrome. So this would be just on the inside and outside of your patellar tendon, so just below your kneecap. It's a very sharp pain, very tender to touch, and it's located just deep from that patellar tendon. And that's something that can be a little bit tricky to diagnose, and not a lot of individuals would test for that or assess for that, but it can be quite sensitive and pain to palpation, something that can respond to physiotherapy as well, but sometimes may involve other interventions to try to help manage the symptoms. So there you have it. We went over 13 different locations of pain and what the possible diagnosis would be if you have pain around that region. Again, remember, location is just one of the factors that we look at when we're determining what the diagnosis is of your symptoms. Regardless, for most, if not all, other than a knee fracture or end-stage severe knee OA, physiotherapy is generally considered the first line of treatment to try to help manage the symptoms and try to help you have less pain and improve your function. Do you have knee pain? Have you been able to discover what the source of your knee pain was? Let me know down in the comments below. If you found value in this video, please consider checking out some of my other videos. I have almost 500 videos on various physio, exercise, and medical related topics. Until then, we'll see you in the next video. Thanks for watching.